facial nerve is the seventh cranial nerve. It is mixed but predominantly motor. It is made up of four nuclei, namely the motor nucleus of facial, superior salivary nucleus, spinal nucleus of trigeminal, and nucleus solitarius. It's also called the gustatory nucleus here. The first pathway that we'll be discussing is the brachial motor pathway. The brachial motor pathway starts at the motor nucleus of the facial canal, travels backwards just around the abducent nucleus in black. It forms the facial colliculus on its pathway. Then it travels downwards just below the pons and above the medulla, exits the brainstem, then travels to the internal acoustic meatus and the petrous part of the temporal bone. Then it travels down the labyrinthic part of the facial canal to reach the geniculate ganglion, where it takes a sharp turn. Then it travels down the temporal part of the facial canal, and then the mastoid part. Exits through the stylomastoid foramen. Before it exits, still gives a branch to supply the stapes in the middle ear. We're going to discuss the external branches of the facial nerve later on. The three other pathways, the visceral motor, the genitourinary sensory, and the special sensory, they all exit the nuclei shown and then form something called the intermedius Risberg. The visceral motor pathway falls and reaches the internal acoustic meatus until it reaches the geniculate ganglion, where it splits into two. The first pathway we're discussing here is the greater petrosal nerve that passes through the greater petrosal foramen. It then reaches the pterygoid canal, but joins with the deep petrosal nerve to form the Vedian nerve. This nerve then enters the pterygopalatine fossa to reach the pterygopalatine ganglion. And then we have to just mention that there's a branch from the maxillary nerve that connects to the pterygopalatine ganglion. The post-ganglionic nerves from here reach the mucosa of the nose to supply and innervate it. Going back to the second branch, here it goes down the temporal part of the facial canal, then the mastoid part, and then enters the middle ear cavity to reach and exit through the pterygotympanic fissure. This is the chorda tympani. The chorda tympani joins the pathway of the lingual nerve, that is a branch of the mandibular nerve. The chorda tympani reaches a ganglion, which is called the submandibular ganglion. The post-ganglionic nerves connect then to the sublingual and the submandibular glands. The general sensory, which is sensory pathway, it makes sense to point out that it starts at the ear to deliver the sensory impulses. Here some nerve rootlets connect to the ear and they enter through the stylomastoid foramen. Just to reach that spot at the geniculate ganglion, The nerves travel from the ear up the masseter part, the temporal part of facial canal, to reach the geniculate ganglion, and then they travel up the labyrinthic part to connect back to the intermedius Risberg. Starts at the spinal nucleus of trigeminal. Next, we have the special sensory, and starts at the tongue. Its main job is to deliver sensory impulses from the anterior 2/3 of the tongue. It passes through the same pathway as the lingual nerve, then moves together with the chorda tympani, through the pterygotympanic fissure, then crosses the same pathway until it reaches the geniculate ganglion, then travels up the labyrinthic part of the facial canal to reach the intermedius Risberg, and ends at the solitarius nucleus, which is also called the gustatory nucleus here. You have to remember that the external branches of the facial motor exit through the stylomastoid foramen. As it exits, it splits into so many branches that we're going to discuss right now. First off, it gives off a branch that goes vertically upwards, and it's called the posterior auricular nerve, which splits into two: the auricular branch and the occipital branch. Then it supplies the stylohyoid muscle and the digastric muscles. So two branches right here. Then the end, it passes through the parotid gland to split into 5 main branches: the temporal branch, zygomatic branch, the buccal branch, the marginal mandibular branch, and finally the cervical branch. The most important one of all is the zygomatic branch, as it supplies the orbicularis oculi muscle around the eye.